my name is Michelle Morrison, and today I'm going to show you how to don and doff PPE gear for the COVID that's happening right now. So today this is going to be my gown that I'm going to put on. This is going to be my mask. This is a surgical mask, but we would like to be using an N95. These are going to be my goggles and my gloves. Okay, so to start with donning, which means how you place your PPE gear onto you, is we're going to start with our hand hygiene. So that's always important. So if you're there, usually this is before you even go into the patient's room. You're going to, if it's Germ-X, you're going to be sitting there and you Germ-X for 20 seconds, okay? So you're going to want to get up to your wrists, in between your fingers, and rub it in until it's dry. So now that I have my clean hands, we're going to take our gown and we're going to place our gown on. Okay. So our gown is on. And so the next thing we're going to be doing is taking our N95 mask. So it has a metal strip on it. And what we want is to, when we place this on, we want to make sure that this is pinched and has a good seal on it, okay? And so with that, we can do a leak test, okay? And then the next thing you're gonna do is put on your glasses, your goggles, and so it's good to pick them up by the stem and put them on. So now you have your goggles, mask, and gown on. And now it's time to put your gloves on. And so when you place these on, my gown is not all the way to my wrists, but in the proper situation, you would want the end of the glove to go over the cuff of your gown, okay? So now that you're in your full PPE gear, you can now go into the patient's room. So now we're gonna act like I am done, and I'm going to be removing, which is doffing your PPE gear. So when you do this, you're still inside of the patient's room at this point, okay? So what I do first is you're gonna remove the gown. So you're gonna pull the top up here around your chest, and this is my trash can, and we're gonna pull it off this way and make sure it comes off. And at the same time, we're taking our gloves off with this gown. Just one, it will probably get stuck in there anyways, just one fluid motion, just pull it off. Next is your goggles. So you're gonna be taking the goggles over it and you just drop it if they're disposable. Now at this point, you want the mask on while you're still in the patient's room. So now that everything else is off, I'm going to be leaving the patient's room, and that's when you take off your mask, and you take it off by the elastic band and drop it in where the exposed side is off. And again, last but not least, you're going to do your hand hygiene. So say your hospital does not have Germ-X available and they have soap and water. So for soap and water, I'm going to use this example. So you would go up to the sink, you turn the faucet on, right? And you get your hands wet. And then with that, you get about a teaspoon of soap, so about dime size of soap. And you're gonna be scrubbing it in for 20 seconds. So most people can sing the happy birthday song or the ABCs twice in this amount of time. So make sure you get your wrists, underneath your fingernails, and in between your fingers as well. And then you're gonna, the water's still running, and you're gonna rinse it off underneath, and then you're gonna grab a towel. Don't turn the faucet off with your bare hand. You would take a towel kind of like this, and you would turn it off with your hand protected by the towel. Okay, and then you would use the other part of the towel, like you would dry your hands off and then turn the faucet off and then dispose of it. All right, thank you so much.